What are some of the other meds you've been prescribed for POTS? Because I'm not a one-trick pony. I am a medical doctor, and I do know about all these meds. And I also know about what works. How commonly doctors are prescribing these medications and how long they put people on it. And then they wonder why, like 6 months or a year later, somebody comes up with a diagnosis of POTS or dysautonomia or new autoimmune disease or mast cell or histamine problem, right? If none of these cardiology meds, antihistamines are going to work for POTS, and now I understand why, what does work? Well, let's go back to the 3 underlying mechanisms. Number 1, it's a nervous system dysregulation, autonomic nervous system dysregulation, meaning fight or flight versus rest and digest. Number 2, immune dysregulation, meaning that the immune system is hypertriggered by infections or hypertriggered by allergens, right? And then also number 3, which we haven't touched into, is doctors don't even talk to you to ask you questions about, was there genetic predispositions in your family? Were there clues with the immune system, allergy system of your family, hormonal systems in your family, digestion problems in your family? Has anyone actually asked you those questions about your history? I mean, how many of you with POTS, dysautonomia, long haul even had doctors that asked about these types of questions? Well, they wouldn't know the ask. They wouldn't know what to do with the answer. So for me, that's why it's really important for people to talk to us. And for me, a couple things is that in order to assess somebody to say, well, what would work for you would be to say, well, what's the underlying causes? We have to ask questions like, what are some of the underlying, what's family history? What's your past medical history? What are things that you've tried and haven't tried? What has worked? What doesn't work? And what's your readiness level to really learn about this? This is education. I know because people after Mayo Clinic, after Johns Hopkins, after Cleveland Clinic, come and watch something like this, and this is what they tell me. I've learned more in that 30 minutes, 40 minutes than I ever have in all those doctors' visits combined. So what would work? We have to address those root causes, right? Which is why on the workshop that I recently did, we talked about how do you address, how do you test? What are things that you need to do to test, assess, and the tools that you have to deal with autonomic nervous system dysregulation? What are the things that you have to do to calm the immune system from attack, right? What do we do to actually look at what's the environment in your body that's welcoming infection like a welcome mat? Why is that happening, right? And looking at hormones, like we're talking sex hormones, adrenal hormones, thyroid hormones, blood sugar regulating hormones. Like, why aren't your doctors being trained on these things? Because they're not. So that is what works. This is why it's not difficult for me when I work with people to turn around POTS. That's why we're at 876 success cases and counting. And I want you to think about that, right? How many doctors have you worked with that have actually been able to assess any of these things, know what testing to do, what the data actually means, what the pattern is in you, and what are all the tools to fix it? If you have a family history or you have a history of a thyroid disorder, right? Or you suspect that you have, but you've been told your thyroid is normal, then you should watch the thyroid training that I just did, right? But the answer to that isn't just, do you need thyroid medication or not? Which is what the thyroid doctors are going to tell you. You know what? Your thyroid labs are quote unquote normal enough. You don't need medication, go away. Well, no, there's actually 20 other tools I have. If 95% of individuals I work with POTS have an underlying undiscovered or underappreciated thyroid problem, then are there a ton of tools? Yeah. That needs to go into that? Yeah. Could they need medication? Possibly. That the doctors are willing to prescribe? Sure, that's a possibility. Could it be that they need to look at, why is my thyroid so out of whack? Is there an immune system attack on my thyroid? Right? Or looking at sex hormones. Why? I was just talking to Cheryl the other day where she was like, wow, my daughter has POTS. And the last time I did have my hormones tested, I'm 56 years old and my hormone levels were like gone. And I was told that's normal. That is not, newsflash, that is not normal. So these are the kind of solutions that really needs to happen that isn't happening out there at all. So I want to tell you that's how come for me, looking at the whole system, the whole body, and looking at out of the box ways to make measurements, look at those patterns and solve them with tools, huge number of tools, is how I turn around POTS. I hope that was really valuable, succinct and clear and simple. And I also laid out for you what some of the underlying causes and fixes really are.